Welcome to the Paws Perspective.
The podcast where we help dog owners feel calmer, clearer and more confident by understanding what's really going on behind their dog's behaviour.
We're Pat and Molly from Flying Paws Dog Training, and each episode we break down behaviour, training and real life challenges in a way that actually makes sense.
From puppies and adolescents, breed traits and everyday training struggles, we focus on working with your dog's instincts, not against them.
Whether you're trying to prevent problems before they start or you're feeling stuck and not sure what to do next,
you're in the right place.
So grab a coffee, clip on the lead,
and let's get into today's episode.
Hello Molly, how's your week been?
Yeah, pretty good. How's yours been?
Not too bad at all, actually. Yeah, pretty good. This is our first recording for 2026.
It is, and it would have had our new intro.
Yeah, which is pretty snazzy. The last one was pretty good, but we thought we'd change it, didn't we?
Yeah, we've, I suppose, got a bit of we've decided on a bit more of a path for the podcast, haven't we?
Yeah, we have, yep. Like everything, it takes a little bit of time to get your feet and work out what you want and which way you want to go, and away we have gone.
Yes, definitely.
What are we going to talk about today?
Well, we're going to talk about why it's best to condition our dogs to a lot of different things.
Yep.
But I suppose the reason why we're doing this is a bit of a backstory, isn't there?
There is.
So probably maybe not quite 6 months ago, do you reckon?
Mm-hmm.
I'd said to you that I'd noticed a few things with Fox's teeth.
Yep.
We should point out we do have a teeth episode with Zanny.
Yeah, this is different.
This is quite different. I'd noticed some marks on his teeth, which at about 18 months old shouldn't be there. So I'd been umming and ahhing and saying to you for a little while, hadn't I, what do you reckon? Do they look worn? Do they look stained? Like what,
What's the go?
What's the go? And over the weekend you said to me, why don't you just ring the vet? So I did. I rang them on Saturday and got one of the vet nurses who I've dealt with a lot with, Murphy. And she said, I'm on reception Monday. I think it was Monday I took him, was it?
Yep, Monday.
And bring him in and I'll have a look. If it needs a vet appointment, we'll make a vet appointment. If it doesn't, we'll go from there. So it's his, sort of side ones nearly towards the back, isn't it?
Yep.
His two top ones that have this weird, marking on them. So took him in. He's a bit like Murph, thinks the vet's a great place to be. So he was happy just to toddle in there. He hopped up on the scales and waited for the vet nurse to be finished with what she was doing before she came out. And I lifted up his gums and showed her, and she said to me, there's good news and there's bad news. So the good news is that it is just staining.
Yep.
Which is best case scenario.
Yep.
The bad news is at not even 2, he shouldn't have any.
Mm.
So we had a bit of a chat, and basically what we've settled on is he's going to be a dog that is just going to be genetically more prone to have teeth issues. And that's not anything bad about his breeding. It is just he's actually quite a well-bred dog. It's just one of those luck of the draw things, isn't it?
Just like humans, sometimes, yeah.
So we're now, for me, in uncharted territory. I've never really had a dog with teeth issues.
Not like this, no.
No, not like this. Our miniature fox terrier did, but by the time we sort of knew there were teeth issues because he wouldn't let you near his mouth, it was more like, yeah, okay, about 10 have to come out. But so not quite like this, no. And Murph's teeth,
pretty perfect.
Yeah, been very lucky with him. He's coming up for 11 and he's still no plaque, no tartar, nothing, very lucky with him. So yeah, I did say to the vet, I said, this is all new for me, and she was like, okay, well, here's what we can do. So we've talked about, I'm going to put him on a supplement. He does get a lot of bones. I'm probably going to change some of them slightly so they are more going to target the area that is affected. But obviously the most effective thing to target that is going to be brushing his teeth.
Yeah.
So when I was talking to you about it afterwards, I said to you, I'm going to condition a toothbrush.
Yeah.
If this is something like realistically he's going to have for the next 13, 14 years, I don't want it to be hard for me or him.
No, want him to enjoy it and participate in it.
Yeah. So then I suppose we got thinking and thought, well, actually, this might be a good podcast because there's lots of things that we should be conditioning and creating as cooperative care opportunities, isn't there?
Yeah, there is. A lot of things that we do with our dogs. Wide ranging, really. This is the thing. It's it might even be not necessarily a toothbrush. It might be just being able to lift their lip up so you can have a look at their teeth. Going and getting vet checks. Going to a groomer's if you need to. Nail trims is a big one.
Yeah, or just grooming at home.
Yep, yeah. Grooming at home. Being able to look in their eyes and their ears. They're all good things to be able to do. Cones. Sometimes, if they have an operation, they might need a cone. You've done one on that. You've done a bit of a video on cones. Getting them used to different things, towels, all those, brushes.
Administering medications if they need
it. So there's a lot of things that we can condition instead of just rushing in when we need to do something and grabbing them and doing it sort of thing.
Yeah, so when I suppose we talk about conditioning, what we are saying is what the ideal end result is for the dog to be actively participating in their own care and to be creating positive emotional responses to handling it. And it's not about tolerance.
No.
It's about willingness and cooperation.
Yep, definitely. So, because a lot of dogs, they struggle with a lot of these things.
Because it's just rushed, and I don't think that's necessarily a reflection on people deliberately setting out to make their dogs hate it.
Oh, no.
I think it's just a time poor.
Yep.
We often do a lot of things like this when they're pups and then let it slip into adolescence.
Yeah, because you get busy and doing other things and life happens.
Yeah, and I did I end up reading that to you yesterday? Or did I just say to you about it yesterday? There was a post by is she a physio?
I'm not sure.
Yeah, in Sydney. You know who I'm talking about?
Oh, yeah, she is.
She's a physio, and she had a post on why dogs will get to adolescence and all of a sudden hate nail care.
Yeah.
And it's just where their brain's at.
Yeah, that's exactly right.
It's just a normal stage, but we will then go, you were so good at it, and instead of taking that step back and going, let's start again, we just go, you should be able to do this, and that's when we restrain, we force, we rush, and problems happen.
Yeah, and we don't mean to. It's just, you've got to have your toenails clipped, or you need a brush or whatever, and we just, like you say, they were going okay, so they should be fine with it, and we just do it. But it's also something, we think about going to puppy class and we learn to do a sit and a drop and whatever else you do in puppy class, those sorts of things. But sometimes, even though you might be taught to do some of these things, you sort of forget about those things sometimes. And they can be good little quick things that you can do as well.
Yeah, definitely. There's a lady that comes to one of our classes. Her dog's about to turn 9 this year, isn't it? And she often says the best thing she learned in puppy class was eyes.
So,
and that dog's been coming for 9 years and has learned a lot of things.
Yeah, and we still do those things. I still do lots of little basic things with Zan. You probably do with Murph, and Foxy's a bit younger, but...
well, Murph's had a lot of...
ear issues.
Ear issues, which I don't know if we've discussed that on here.
Probably.
Probably, maybe not. He, for a long time, had quite chronic ear infections. He'd get over one and one would just come back again. So I am very lucky that he has had such positive experiences that, one, it was easy to deal with at home and at the vet, but two, he had good vet experiences up until that point, and he loves going to the vet.
He does, doesn't he?
He does. When he realises we only go that way, take that road to go to the vet, pretty much. So, once we hit that road, takes about half an hour to get to the vet. The next 20 minutes are like just excited Murph in the back of the car. Because he'd had such good experience and he loved the staff so much, it was okay. And actually last time he had an ear infection, which was October, there was a new vet nurse and I'd never met her before. I don't think she'd been there very long either. And the vet is the owner of the vet clinic that was there dealing with him. And he knows by now that, like, he can just look in Murph's ear. I might have to hold his head if it's a little bit sore, but when I'm saying holding his head, I'm very lightly, holding it in the right position for the vet. Well, the vet got down onto the floor to look into his ear and she jumps up and went to restrain him and he's like, oh, no, it's all right. And she's like, oh, are you sure? And he's like, yeah, trust me, we're all good. And she watched him get done. She's like, I don't think I've ever seen a 45-kilo dog not be restrained for an ear check. I was like, yeah. I'm pretty lucky.
Yeah, and that's what you want. But that comes down to having lots of positive associations before that happens. But once you know if they do get an ear infection, you still need to continue on, and it's not always stick something in their ear that's, might be something that you have to put down there or the vet. It's just lifting their ear or touching their ear and giving them some treats sometimes.
Yeah, and I think using ears again as an example, I think a lot of the time that sort of handling will happen when there's a problem.
Yeah.
So the dogs are already stressed. There's possibly restraint involved, and they might not have been to the vet a lot, so they might be in an unfamiliar environment, which is one of the reasons why we still say in puppy class, don't we, to take them to the vet?
Yep.
I forget what we say in puppy class. I hear you say it so
often.
And Fox has been, because Murph had to go so much, Fox didn't go every single time Murph went to the vet, but, in his life, he's probably only been to the vet with me 3 times for an actual appointment. And in the nearly, it's a bit over 18 months now that I've had him, he's probably been to the vet a dozen times. And jumped on the scales, been in the weight rooms, seen the staff. So the environment is now a fairly semi-familiar environment.
Yeah, which is great. Just duck in when you're going past, sit there for a couple of minutes. Yep. Always go and ask the vet staff at reception if it's okay, and just make sure that there's not another dog in there that needs a bit of room or space. Yeah. Just go in there for a couple of minutes.
Yep. Yeah, and there's not many vet staff that will say no.
Yep. No.
So, and if they do say no, like you said, it's probably for a good reason, that they're dealing with an emergency, or there is a dog in there that's not going to make it, or animal in there that's not going to make it a positive experience, and you just, go, okay, we'll wait, or we'll come back another day.
Time.
Yeah.
Easy.
So when all of these things happen and our dogs are stressed and we've restrained them, they start to learn that in this situation, or when this part of my body gets touched, hands are not nice.
Yeah.
And I'm not in control of this situation.
No.
So then we usually see the big signs, which are avoidance, growling, snapping, biting. But what is often missed is one of the biggest signs, which is freezing, isn't it?
It is.
And we mistake that for the dog cooperating.
Mm-hmm.
But if we look at the body language a little bit more in depth, they're actually just standing there waiting for it to be over.
Yeah. Yep, definitely. So shutting down and, can't move, which we don't want.
No, and that's not being able to actively participate. That's just tolerating it until it's over.
It's over, yeah.
Which we know for ourselves, if you don't like the dentist or you don't like the doctor or a hospital, that, you don't want to be just putting up with it until it's over.
No, you don't. We've got a bit more context. We know that, you might have to go to the dentist to get your teeth checked, but for your dog, they're sort of not sure about things, so they haven't got the context we've got. We can't talk to them to the degree we can talk to another human. So, we need to do some other things to make it a better experience for them, and so that they've got a bit of agency in the decisions of what's happening.
Yeah. So why does welfare matter in cooperative care?
Well, the main one is we want them to be able to say no if they don't want it. We also want them to be able to participate, and hopefully participate. What's the right word?
Willingly.
Yeah, willingly. Yeah, participate in it. So it reduces their fear.
Yeah, and their stress.
And their stress levels, which is, I mean, none of us want to be stressed or fearful. We can also make it a little bit more predictable. So that, you can use, it's where you can use certain cues so that they know, oh, okay, that means this is going to happen, but what's going to happen is okay. And if I'm not too sure about it today, I can say no.
Yeah.
It also builds emotional resilience.
The control aspect there, that they feel in control.
Yeah, and we all like to have, control of our life. So this is just giving our dog some control.
Yeah. So by conditioning and employing cooperative care, we actually can end up with faster, calmer vet visits.
Yeah.
So a bit like I was saying with Murph, and even with Fox, and you would have found it with Zed in the past as well. But on Monday, I just told him teeth. He put his hand up. We'll talk about that a bit later on. But he puts his hand up into my nose. I can just whip his gums up, and the vet nurse could have a look. There was no scruffing.
Worming.
There was no headlock. There was no. It was just quick, simple. She could get in the right angle to have a look. Same with Murph. Like, his vet visits are fairly quick with his ears. Partly because he just goes, okay, no, this happens and this happens and this happens. But they've all been good experiences too.
Yeah.
It's safer
Yeah.
for everyone. It's
yeah.
safer for you. It's safer for your vet, your groomer. It's safer for the dog.
Yeah, exactly.
There's less need for sedation. Obviously, we will advocate for dogs that might need sedation in certain situations if it is going to make their life easier, if they've already got a negative association with the vet and you need a vaccination, say.
Yeah, and you might need that while you're working on changing the association.
Yeah. But if you can get good associations from the start, there's less need to put them in those sort of on those sorts of medications for the vet visits. It means things can be caught quicker because people aren't scared to take their dog to the vet or the groomer.
Yeah, and that's something that you mightn't think about either. Is you might think, oh, might be something wrong. I'm not 100% sure, and then you go, oh gosh, it's going to be a drama. Going to the vet, so I'll just leave it another day or so, or just leave it a little bit longer, just to see how it goes, because then you're starting to stress about what's going to happen when you go to the vet.
Yeah.
If you're not worried about it, makes it a lot easier, and you can pop in and see the vet and get a check like you did.
Yeah, and ultimately all of that ties together, doesn't it, with improved emotional well-being for our dogs. And for us, because we're not as stressed.
Yeah, and if we're stressed, our dog's going to be stressed.
Yeah. And the vet staff aren't as stressed, even though they all do an amazing job, but it can be stressful for them. They can get put in stressful situations. Yeah. Same with groomers. So
they don't want to have to, restrain dogs and things like that if they don't have to. So,
no. So let's talk about behaviour prevention.
Behaviour prevention. Common triggers for that are, your normal things like trimming your nails, your grooming, what we've talked about with ear care, going to your vets, your groomers, all those sorts of things. Even with your vets, stethoscopes, things like that they're not used to. They can be a bit stressful. So if we can condition our dogs to things like that, it's going to be a lot better off for them, isn't it?
Yeah, and I mean, I suppose so far the theme of this has been that, most of the time we see these reactions with any sort of handling or cooperative care because the dog is feeling like they're in a stressful situation. So if we can prevent the rehearsal of defensive behaviours and the dog doesn't have to do them to start with, we're going to be 10 steps ahead.
Yep.
And ideally, starting off when they're young.
Yeah.
And it's never too late.
No, it's not. But continuing it on too when they're pups, like as you said before, sometimes, life gets busy and you might have started it in a puppy class, but then you forget about it. It's the thing that you forget about. But if you can, make a note on the fridge or something like that on your phone. Set some reminders, and just doesn't have to take long.
No.
Only a few seconds, just to keep these going. But as you also said, never too late to start.
No, and I think probably something really important to add in here too is, especially with adolescents, remembering that their brain is literally rewiring.
Yeah.
It is growing, pruning, recoding neurons in the brain, not to get too technical, which means they will use it or lose it, basically, which is why you often see recall go out the window, because pre-adolescents, they were fantastic. So we wean off the treats, we wean off the reinforcement, and then their brain goes, well, that's not that rewarding anymore. I won't worry about that, and we lose it. So it's exactly the same with cooperative care, which is exactly like the Facebook post we mentioned. I might link it in the show notes. I'll make a note to do that. But it's that keeping skills up, basically.
Yeah, it is. Yeah. Just it doesn't have to be long, just little quick spurts. What are some of the common myths?
I think probably one of the biggest is they'll get used to it.
Yep.
And I think this isn't just with cooperative care, this is with a lot of things with our dogs. We are conditioned ourselves to think that, the more they do something, the more they're exposed to something, the more they see something that they don't like, they will just get used to it.
Yeah.
If it's not done in a very careful way, it can actually make things a lot worse and cement certain behaviours.
Yep.
Another is they're fine, they don't bite.
Yeah.
Just because we're not biting doesn't mean we're not feeling emotions inside.
That's exactly right.
And on the canine aggression ladder, as it's commonly known, isn't it? A bite is the top step.
Yeah, it is.
So there's like 10 steps
Before that?
Before then. And if your dog's at a point where it's actually biting, it's been pushed a long way.
Yeah. Yep. So
usually.
Yeah. And, this is where we talk about body language, but body language isn't always as easy to see.
No, and some dogs, I was just thinking, like when Zan was a bit younger and it was during COVID, wasn't it? He had an ear infection, and I wouldn't say it wasn't a very good experience but for him, but you couldn't go in with him, so you don't really know what happened. And when you had to try and put the drops in at home, there was a few issues.
There was.
And he was once or twice did jump to a bite, didn't he?
Yeah, he did.
But he's probably not only a breed of dog, but a dog that would use his mouth quicker. So it's knowing the dog in front of you too.
Yeah, that's exactly right. Yeah. So, it wasn't, I don't think, and it was not like a bad vet or anything like that. They were good.
No.
It was just that, it was that point where you couldn't go in. You still take your dog to the vet, but you couldn't go in with them. And
he was very young then too.
He was young, and he does, if probably Murph puts up with things a lot more with his ears than Zan's, and I don't think particularly likes having ear infections, so he arcs up quite quickly. So, having someone strange look in his ear and, obviously had a bit of a poke around in there and cleaned it out and did whatever, the next time you went near it, he was like, oh, I don't think so.
And I think it links back to his tooth episode too, but it also links back to if we can get cooperative care happening and we can get health checks done earlier, the dog's not in as much pain.
Yeah, that's
right.
right.
Or the dog's not had to put up with as much pain or soreness or whatever it might be for as long, that we're not going to be as defensive. We're going to be, okay, I'm a little bit not sure, or I'm a little bit sore, or I'm a little bit, whatever, but I can cope with this.
Yeah, exactly. So, the other one is saying, I guess, going back to myths, is saying the vet or the groomer will handle it.
Yeah.
Just palming your dog off into them and they'll handle it. They handle a lot of dogs. They're used to handling a lot of dogs, but, you don't want to just palm your dog off and let them worry about it. Your dog's still not going to be feeling that great.
No, and you, going back to Zan a second ago, you were obviously in a situation where you had no choice, And like you said, nothing necessarily bad happened in there. It was just I'm with people I don't know.
Yeah.
I'm in an environment I'm maybe not 100% comfortable in, and this is when,
I think it was
problems.
a little bit different because I think I spent a lot of time going to the vet then, so he was fine with it, but it was all different.
Yeah.
Like, you didn't actually go into I was in the car park and I couldn't go out of the car park,
And they would have been in masks.
They would have been in masks and
all these sorts of things.
Yeah, it was just a totally different sort of setup than normal. So and on top of that, his ear was sore.
Yeah, quite sore.
Yeah.
I think it's also probably really important to point out at this point too that you can look up statistics if you're interested, but veterinary staff have one of the highest suicide rates of any profession.
Yeah, which isn't good.
It isn't good, and, a lot of it comes down to situations they're put in with dogs. A lot of it also comes back, which we won't get too much into this because this is going sideways, but, veterinary costs and all of this sort of stuff, like when really at the end of the day they're in it for the animals.
Oh, yeah.
99% of them are in it for the animals. So, we want to protect them, and groomers as well. Groomers are much needed, especially now we're getting into a lot more poodle crosses that do require a lot more grooming. We need to look up to people in
Those
these
sort of people.
Yeah.
Yeah, definitely, because, we need them and we don't want to lose them just because, dog's aggressive.
No.
And the other one is they're not reacting, so they're okay. That goes back a bit to our freezing.
Yes, it does.
Where they might be coping with, not coping with it. They might look like, or you might think they're coping with it, but they're actually frozen.
Yeah.
They're quite stressed.
Yeah. So I think it's really important that to understand that in all of these situations, the dog is learning. Dogs are constantly, whether we're actively teaching them something or not, they are constantly learning.
Yep.
And their emotional state matters the most.
Yep, that's exactly right. What's good conditioning look like?
So it's starting nowhere near the end result.
Yep.
So if we go back to probably Fox's teeth will be a good example because, like I said to you when I was talking to you after I'd been to the vet, I said, if he's going to have this done, if I'm going to have to brush his teeth, I don't want it to be a fight.
No.
I want it to be something that, if he doesn't ever completely think this is the most amazing thing in the entire world, that's okay. But I just want him to go, this is not a bad experience.
Yeah.
I'm okay. This situation's okay. So he's never probably seen a toothbrush. So I will be starting very slowly.
Yep. And when you say very slowly, because everyone's got a different version of very slowly, and I know this is a bit hard because you never really know, but when you think I'm going to start slow and your end result is that you can actually brush his teeth, what sort of time frame are you thinking that you might you might be able to actually brush his teeth?
So if I can brush his teeth by Christmas, I'll probably be ecstatic.
And that's Christmas 2026?
It is Christmas 2026.
So that's, what's that, 11 months, 12 months?
Yeah, 11 and a half months.
Yeah.
Yeah.
So when you say slow, it is slow.
This will be slow because, I do have it in the back of my head that possibly it will happen quicker than that because of associations he already has. But I've also got that in my head because if it's quicker than that, that's fantastic.
Yeah.
We're ahead.
It's a bonus.
If it takes that long or a bit longer, it's like, well, okay, that's the time frame I've got in my head. So I'm not setting myself up for disappointment or him up for failure in my expectations of what we need from this situation. And they will be like 10-second sessions to start with.
Yeah.
Which might be the toothbrush on the floor.
Yep.
And he comes in and looks at it and he gets heaps of treats. Like it might not even be him touching it or going up to it, or it just depends what his reaction is the first time to seeing a toothbrush.
Yeah. Know where to move to next sort of thing. Yeah.
Where I think there might be a chance we'll progress quicker. And this is not to rush things. It's just
if you can.
if he can, and with his prior behaviours that
Learning.
he already has, is that he already has quite a solid teeth cue.
Yeah.
He has an understanding of what teeth are, I suppose, to a degree, and what happens when someone says teeth to him. But I'm also really careful, and I think this is something people need to be conscious of if they are going to use cues. And I will be using, I think we'll get into that in a second, won't we, start and end cues. But I don't want to poison the current cue we've got that I then can't do what I can do now.
Yeah. Yeah. So when you say that, you use teeth now to look at his teeth. So will you be using something like a brush so that he knows teeth, and a toothbrush, or mightn't be brush because you might use brush for grooming.
I haven't really thought about it, to be honest. Colgate. I think I will start with teeth and see where we go from there, because like I said, he does have a good association with it.
Mhm.
And then if I need to Q transfer, I will, which if people don't know, Q transfer basically just means changing the name of a Q, so turning a sit into pizza or, whatever, it doesn't really matter, but it's just changing the name of the behaviour.
Yep.
But I think for me, that'll just be a see what happens.
Yep, and sometimes it is. Are you going to have a NQ then so he knows you've finished and he can get up and off he can toddle?
Yeah, which will just be his okay,
Yep.
which is just his release word. That'll be we're done, which it's important for a lot of dogs. I think with Fox it's really important. He's a dog that really needs a release cue.
Yep.
Because otherwise if he didn't want to, he would just, which I will let him remove himself in situations if we're training and he doesn't want to. But he needs slightly clear communication about where we're at with things. That's just who he is.
Yep.
But yeah.
No, that'd be good. I think talking about the length of time too, setting yourselves a longer time frame. As you said, then you're not disappointed if it takes that long, and you're also happy if it's quicker. But if you think about it in the lifespan of your dog, if Foxy's around 15, 16 years old, you've spent, say, 11 months teaching him one thing. You've got that then for 14, 15, maybe even 16 years. There's no problem.
Yeah.
So when you look at the time frame in that sort of a way, it's really not that long.
Yeah. I think the other thing that I've just thought of too that's going to be really important for anyone conditioning anything is making sure the dog is choosing to stay engaged. I was just thinking of that when I was saying about him choosing to leave with a release word. If I don't know, got to the step where the toothbrush was touching his mouth and he chose to leave,
he does.
That's fine. He can move away. He can get some rewards. I think sometimes we're scared to reward choices like that because we think,
they're not going to come back.
Well, we're rewarding the wrong thing.
Yeah,
I think is what people are scared of. It's like, if they pull their paw away while we're trying to do their nails, or they shift away when we try and brush another area. All you're doing is saying, I'm listening to you. I've acknowledged what you've said. Thank you for telling me. And what the dog actually starts to do is go, okay, if I don't want to do something, I'm going to get listened to.
Yeah.
So maybe if I try that again and I'm not comfortable, I can still move away.
Yeah.
If you are getting repetitive moving away when you touch a certain area or go to a certain step, that's information for you that you've moved too far.
Yeah.
So there's two sides to that coin. I think if you do, say, 5 reps of something and none of them are any good, you've moved too close.
Yeah.
Or too far, sorry.
Yep.
But if 3 out of 5 are okay, it's like, okay, we're just working this out. 5 out of 5 are okay, it's okay, maybe we're ready to see if we should move to the next step.
Yep, definitely. And that's with everything, not just Foxy's teeth, getting his teeth brushed. It's trimming their nails, giving them a brush, looking in their ear.
I think it's looking at the equipment you're using too. Like, he's had no problems with being brushed. He's been quite easy to brush, but I had the comb on him the other day and it got snagged in. I told you, didn't I? It got snagged in his flank.
Oh, you didn't tell me that.
Oh, didn't I? And I brushed him and like I was brushing the same as I'd been brushing, and it got snagged, and it obviously pulled, and he like gave a little yelp. And now that comb has been like, okay, that comb hurts.
Yeah.
So we've gone back to using just the paddle brush.
Yep.
And we're just like, he had a brush this morning, no problem with the paddle brush. Paddle brush is fine. I don't know if I can be bothered reconditioning the comb, to be honest. But if I am going to recondition the comb, I'd probably start brushing somewhere like the top of his head.
Yeah, where it's really easy.
Or he's maybe not his back, actually, because that's quite close to his flank, but we're going to start easy.
Yeah.
But I don't think for the most part he needs that much of a comb. Do you? For his coat?
Well, yeah, I reckon his coat will still get a bit bigger.
I'm going to ignore that.
I brush Zan and then always comb.
Yeah.
But, yeah.
I'll cross that bridge if I feel like I need to get to it. But basically what I'm saying is it's a problem, but it's a problem that I've just gone, okay, I can't be bothered dealing with that right now. And that's okay.
Yeah. Yep.
It's okay to go, we're happy with the paddle brush. We're happy with, everything else. We'll just park that at the moment.
Yeah.
We've got bigger fish to fry.
Revisit it if you want to later on.
I could just get you to do it for me since you think he needs combing. I'll pay you like a groomer.
Oh, okay. Well, there we go.
$2.50.
That's not even going to get me not even going to get me a coffee.
Hey?
That's not even going to get me a coffee.
Yes, it is.
Oh, I need Hungry Jack's if you use the app.
Yeah. So what is getting back off coffee? Why do I always end up on coffee?
Oh, I don't know, and even know how much the prices of coffee are, depending on how you use it. It's a bit of a worry, isn't it?
Mm-hmm. Yeah, it says more about you than anything, I think.
Yeah, well.
What are the real life implications or impact, sorry, I suppose is a better word, of cooperative care and getting our dogs actively participating? What do we see?
Well, one of the biggest ones, I think, is the stronger trust.
Yes.
Between you and your dog. You've got a better relationship. You might already have a good relationship, but then it's like, oh, the brush is coming out, that's going to hurt, or oh, the nail trimmers, they're never any good. Yeah.
I think we've even seen that in private session clients, and obviously I'm not going to name names, but there was a lady last year, I don't know if you get it from what I'm about to say, but she had a little dog that recall was shocking, and she used to have to, like, when she wouldn't let it off, I don't think. It would just like nick off out the front door if it got a chance and things like that. And to catch it, she would have to like basically jump on it. Do you know who I'm talking about? Yeah. And, the dog was a bit wary of her just because of those couple of situations. They didn't have a bad relationship. It was just your hands, usually me. And she had to grab it because it was off lead running around and had no recall. So it might have grabbed, it might have hurt, it might have done all these things. But once their relationship was stronger, after 3 or 4 sessions, we could start to see, wow, actually this dog's coming up to her, it's doing a hand touch, it's going into middle, it's doing all these things that, to start with was like, I'm not too sure about being around mum. Yeah. Because, if I'm off lead, that doesn't usually end well. So seeing that improvement in the relationship is huge for everybody.
Yeah, definitely. It's nice to see your dog too when you can say a cue offering something. So I've been doing tonsils with Zen, just having his mouth open. So I can pretty much say tonsils now, and he sort of goes, oh, I know what that means. And you can see his mouth start to open. Yeah. So, offering a paw, happily going to the vet like Murph, those sorts of things. I
don't think you want your dog as happy at the vet as Murph.
Oh, well, wouldn't hurt.
No.
And just increased confidence in daily life.
Yeah.
Because they're not worried about what might happen or what's going to happen. So, I think they're all really good options for the daily life of your dog.
And I think it's really important to know you don't need fancy equipment to do any of
that's a thing. Yeah.
Obviously, if you're going to go to the step of you need toothbrushes or you need brushes or you need nail equipment, but even going, well, they don't like their nails being brushed, nails being clipped. So what else can we do? Do we look at a scratch board? Do we look at, all of these sorts of things. There's a lot more options now.
Yeah, there is, and there's little grinders that
Dremels and grinders.
some dogs might prefer rather than the actual clipping of the nails.
Yeah.
Yeah, there's a lot more options than there once was. You've got a scratch board for Foxy, and that actually goes quite well.
Yeah, it does, and I've got a Dremel.
Yeah.
For both of them. Murph's nails need clipping just because they've always been quite thick. And it took me a long time to find clippers that would actually clip through them. But yeah, it's just, if you want to go to the next step and do proper cooperative care, like you just need like a towel.
Yeah.
A station, which might be a stool,
Yeah.
or it might be a chair or so all of these things can be done with minimal equipment. And you see, like we said, you see lifelong benefits with dogs that, that they might need something done for their entire life, like Fox is probably going to need to.
Yep.
And it's going to improve his safety, that he's not going to, panic if he sees the toothbrush or something stupid and hurt himself, or, and our relationship is not like, well, you've got that scary thing again, I don't like you. So it's just making their lives easier as well as ours and our vets and groomers.
Yeah, definitely. So, and it's just another way to, a nice, slow, steady way to interact with your dogs, have a good relationship with them.
Yep.
Doesn't take long. You don't have to spend long doing it. A minute or two, a few seconds, whatever you've got. So I did quite a while back, I got the toothbrush out and was starting to do a bit of that with Zan. And
what sort of toothbrush do you have?
Oh, it's a soft one.
Is it a human one?
Yeah. It was just a soft one.
Like a kid's one? Or
Yeah,
adult's one?
yeah. I think it had like Mickey Mouse or something on it.
Yeah.
So yeah, it was just a little kid's one. I did it for a while, and then I sort of got waylaid. Yeah. So I think I might. I'll continue on with tonsils. That's going quite well at the moment. What I'm doing there, having a bit of fun with tonsils. So I think I'll continue on with that, but I might get the brush out and have another crack, seeing that you're going to have a go with Fox.
The toothbrush?
Yeah, with the toothbrush. I might get it out and have another go with Zen.
I think I've said to you, I think I'm going to film our progress.
That'd be good.
Probably both process and progress, isn't it? Which, as I said, is probably not going to be like a month short video. It's probably people might have seen last year we did for one of the courses I had to do, was my canine confidence course. I had to do the cone, the vet cone, and that did happen quite quickly, or a lot more quickly than I expected with Fox. And thinking about it now, I should have, because he sticks his head in just about
everything.
Yeah, to the point where it annoys Pat to no end. She lines the bags up near the door and he sticks his head in there all the time, doesn't he?
Yep.
Every day. So thinking about that now, I should have picked something else because it happened quite quickly, but it was enough that it was, I passed my fours. But it will probably be 6, 8, 12 months sporadic. This is where we're at now. This is what we're doing now. I might even have the first video ready to go with this. The post for the advertising of the podcast.
Oh yeah, that'd be a good idea.
Yeah, tie everything in together. But I suppose if there's something you want to change with your dog, it's picking probably what I should have said before when I was talking about it is part of the reason I'm parking the comb at the moment is because toothbrush is more important.
Yeah.
So instead of going, well, we're doing the comb and the toothbrush and everything has to happen in 5 minutes, it's taking the pressure off everyone and going, we can handle this. The other thing actually before I move on from that is I probably am going to have to do something with his teeth in the meantime.
Yep.
I do have some dental wipes, which are Dog by Dr. Lisa. She only brought them out not that long ago. And we got sent a packet, didn't we?
Yes. Yep. I'm going to try those as well.
I'm going to try those, and I'm not... I'm going to give him some rewards and I'm going to make it a positive experience, but I'm not going to condition them the same way as the toothbrush. These are going to be while we're getting to the toothbrush, this is what we're going to do. Doesn't mean that's a fight. Doesn't mean that that's a bad experience. It's just, if you never, ever, ever love these wipes, I'm okay with that.
Mm-hmm.
So it's compromising at times when there needs to be compromise, but not compromising the dog's welfare in that compromise.
Yep. Very good. So, pick something that you want.
Yep. Go
Have a go.
slow.
Yep, go slow. Let us know what you've picked. Let us know how you're going with it.
Yep.
It'd be interesting if people have a bit of a crack at that, but it's a good fun one to do.
Yeah.
And it's lifelong benefits.
Yeah,
as well as being fun. So, good one. Good one to chat about.
It is. It's teaching your dog how to say yes.
Yeah, and saying no.
Yes.
If it needs to or wants to.
And say no to say yes. Yeah.
A good one. Yep. Conditioning.
I think that's about it on our conditioning cooperative care episode.
Yep. No, it's a good one. Alrighty. We will see everyone in the next one.
Yes.
Don't forget to give us a follow and leave us a review if you'd like to do that.
And leave a comment if there's something you're going to work with your dog.
Yeah,
we'd love to know and love to follow along with your journey.
Yeah, that'd be great. Pop them up if you've got Instagram or something for your dogs and we can see how you're going. That'd be awesome.
Yep, all good.
Okay, bye.